Many seniors with diabetes believe they must completely avoid rice, but eliminating the staple food entirely may not be necessary if you understand how to eat it correctly. The way you prepare, portion, and combine rice with other foods can make a significant difference in how it affects your blood sugar levels. In fact, making the right choices about rice consumption could help you maintain better glucose control while still enjoying this important part of your diet. This video is for information purposes only. It is not medical advice. For any health concerns, please consult a qualified doctor. As a doctor, I see many senior patients struggling with the question of whether they can continue eating rice after a diabetes diagnosis. Rice is a primary source of carbohydrates in many diets around the world, and for seniors who have eaten it their entire lives, the thought of giving it up completely can be overwhelming. The concern about rice and blood sugar is valid because rice contains carbohydrates that your body breaks down into glucose. When you eat rice, especially white rice, it can cause your blood sugar levels to rise quickly. This rapid increase happens because white rice has a high glycemic index, which measures how fast a food raises your blood glucose after eating it. Understanding the glycemic index is crucial for managing diabetes effectively. Foods with a high glycemic index cause rapid spikes in blood sugar, while foods with a low glycemic index lead to a slower, more gradual rise. White rice typically has a glycemic index between 70 and 90, which is considered high. This means it can cause significant blood sugar elevation within a short time after consumption. However, not all rice affects your blood sugar in the same way. Brown rice, for example, has a lower glycemic index compared to white rice, usually ranging between 50 to 55. The difference lies in how rice is processed. White rice has had its bran and germ removed during milling, leaving only the starchy endosperm. This removal process strips away fiber, vitamins, and minerals that help slow down sugar absorption. Brown rice retains its bran and germ layers, which contain fiber that slows the digestion and absorption of carbohydrates. This slower process means your blood sugar rises more gradually, giving your body more time to manage the glucose effectively. For seniors with diabetes, this gradual rise is much easier for the body to handle than sudden spikes. Beyond brown rice, there are other varieties that seniors with diabetes should consider. Basmati rice, whether white or brown, has a lower glycemic index compared to regular white rice. The long grain structure and higher amylose content in basmati rice make it digest more slowly. Wild rice is another excellent option, though technically it is not rice, but rather a type of grass seed. It has even more fiber and protein than brown rice. Red rice and black rice are also beneficial choices for blood sugar management. These colored rice varieties contain anthocyanins, which are powerful antioxidants that may help improve insulin sensitivity. Black rice, sometimes called forbidden rice, has the highest antioxidant content among all rice varieties and provides substantial fiber that aids in blood sugar control. The portion size of rice you eat matters just as much as the type you choose. Many seniors consume larger portions than necessary, which can lead to excessive carbohydrate intake even with healthier rice varieties. A standard serving of cooked rice for someone managing diabetes should be about 1/3 to 1/2 cup, which is roughly the size of your clenched fist. Measuring your portions accurately helps you maintain consistent carbohydrate intake, which is essential for stable blood sugar levels. Using smaller plates can help you naturally reduce portion sizes without feeling deprived. When you serve rice on a large plate, even a moderate portion may look small and unsatisfying. The timing of when you eat rice during the day also influences how it affects your blood sugar. Eating rice earlier in the day, particularly at lunch, is generally better than consuming it at dinner. Your body's insulin sensitivity is typically higher during the daytime, meaning your cells are more responsive to insulin and can process glucose more efficiently. If you do choose to eat rice at dinner, try to have your meal at least 3 hours before bedtime. This allows your body time to process the carbohydrates and brings your blood sugar back down before you sleep. Elevated blood sugar levels during sleep can interfere with your body's natural repair processes and may contribute to long-term complications. How you prepare rice can significantly impact its effect on your blood sugar. Cooking rice with a small amount of coconut oil or ghee and then cooling it in a refrigerator for at least 12 hours changes its starch structure. This process creates resistant starch, which your body cannot fully digest. Resistant starch acts more like fiber, passing through your digestive system without causing significant blood sugar spikes. When you reheat this cooled rice, the resistant starch remains intact, providing you with a lower glycemic option. You can prepare rice in bulk using this method and portion it out for several meals throughout the week. This technique works with any type of rice, but is especially helpful if you prefer white rice and want to reduce its impact on your blood sugar. Soaking rice before cooking is another method that can help lower its glycemic impact. Soaking rice for 30 minutes to several hours before cooking removes some of the surface starch. After soaking, rinse the rice thoroughly with fresh water until the water runs clear. This washing process removes excess starch that contributes to rapid blood sugar elevation. The combination of foods you eat with rice is perhaps one of the most important factors in managing your blood sugar response. Never eat rice alone or as the main component of your meal. Instead, think of rice as a side dish that accompanies protein-rich foods, healthy fats, and plenty of non-starchy vegetables. Protein slows down the digestion of carbohydrates and helps stabilize blood sugar levels. Good protein sources to eat with rice include fish, chicken, eggs, tofu, legumes, and dairy products. Aim to include at least one palm-sized portion of protein with every meal that contains rice. The protein not only helps with blood sugar control, but also keeps you feeling full longer, reducing the likelihood of overeating. Healthy fats also play a crucial role in slowing carbohydrate absorption. Adding sources of healthy fats such as nuts, seeds, avocado, or olive oil to your rice-based meals can significantly reduce the glycemic impact. Fats delay stomach emptying, which means the carbohydrates from rice enter your bloodstream more slowly and steadily. Non-starchy vegetables should make up at least half of your plate when you eat rice. Vegetables like broccoli, cauliflower, spinach, cabbage, bell peppers, and green beans provide fiber that further slows down carbohydrate digestion. The fiber in vegetables also helps you feel satisfied with a smaller portion of rice. Try to eat your vegetables and protein first, then finish with the rice portion on your plate. Adding vinegar to your meal can also help lower the blood sugar response to rice. Studies have shown that consuming vinegar before or with a meal can improve insulin sensitivity and reduce post-meal blood sugar spikes. You can add vinegar to salad dressings, use it in cooking, or even drink a small amount diluted in water before eating. Apple cider vinegar is particularly popular for this purpose. Cinnamon is another ingredient that may help improve blood sugar control when added to rice dishes. While you should not rely on cinnamon alone to manage diabetes, incorporating it into your cooking may provide modest benefits. Cinnamon contains compounds that can enhance insulin sensitivity and slow the breakdown of carbohydrates in your digestive tract. For seniors who find it difficult to give up white rice completely, mixing white rice with other grains can be a practical compromise. Try mixing equal parts white rice with brown rice, quinoa, or barley. This combination provides more fiber and nutrients while still maintaining some of the texture and taste of white rice that you may prefer. Cauliflower rice is an excellent low-carbohydrate alternative that can replace some or all of the rice in your meals. You can mix cauliflower rice with regular rice to increase the volume of your meal while reducing the overall carbohydrate content. Many seniors find that using half cauliflower rice and half brown rice allows them to enjoy a fuller plate without the blood sugar consequences. The glycemic load, which considers both the quality and quantity of carbohydrates, is another important concept for seniors to understand. While glycemic index tells you how fast a food raises blood sugar, glycemic load accounts for the serving size. A food can have a high glycemic index, but a low glycemic load if you eat it in small amounts. Monitoring your blood sugar levels before and after eating rice can help you understand how your body responds individually. Every person's blood sugar response to food is slightly different based on factors like insulin sensitivity, physical activity level, stress, and overall health. Testing your blood sugar 2 hours after eating can show you the peak impact of your meal. Keeping a food diary along with your blood sugar readings can help you identify patterns and make better choices. Write down what type of rice you ate, how much, what you combined it with, and your blood sugar reading. Over time, you will notice which strategies work best for your body and which combinations to avoid. Physical activity after eating rice can significantly improve your blood sugar response. A gentle walk of just 10 to 15 minutes after a meal helps your muscles use glucose for energy, reducing the amount that stays in your bloodstream. This does not have to be intense exercise. Simply moving around, doing light household chores, or taking a stroll can make a meaningful difference. If walking is difficult due to mobility issues, even seated exercises or stretching can help. The key is to avoid sitting completely still for long periods after eating rice. Any movement that engages your muscles will help them absorb glucose from your blood more efficiently. Staying hydrated is important for blood sugar management as well. Drinking adequate water helps your kidneys flush out excess sugar through urine. Aim for at least 8 glasses of water throughout the day, and avoid sugary drinks or fruit juices that add unnecessary carbohydrates to your diet. Some seniors worry that eating less rice will leave them feeling hungry or unsatisfied. This is why building balanced meals with adequate protein, healthy fats, and fiber is so important. These nutrients provide lasting satiety that rice alone cannot deliver. When you eat a well-balanced meal, you will feel full and energized without needing large portions of rice. It is also important to recognize that diabetes management is not just about restriction. It is about making informed choices that support your health while still allowing you to enjoy food. You do not have to eliminate rice completely unless your doctor specifically advises it based on your individual health situation. The goal is to find a sustainable approach that you can maintain long-term. Extreme restrictions often lead to frustration and eventually giving up on healthy eating altogether. Instead, focus on gradual changes that become natural habits over time. Start by switching from white rice to brown rice, then work on reducing portion sizes, and finally practice better food combinations. Cultural and personal food preferences matter, and rice holds significant meaning in many families and traditions. Finding ways to include rice in a diabetes-friendly manner allows you to maintain these important connections while protecting your health. You can still participate in family meals and celebrations by being mindful of portions and preparation methods. For seniors living with family members who do not have diabetes, it can be helpful to communicate your needs clearly. Explain why you need to eat rice differently and ask for support in making healthier versions. Most family members will be willing to accommodate when they understand how important it is for your health. If you take diabetes medications or insulin, the way you eat rice becomes even more critical. Your medication dosage is calculated based on your typical carbohydrate intake. Making sudden large changes to how much rice you eat without adjusting your medication can lead to low blood sugar episodes. Always discuss dietary changes with your doctor, especially if you take insulin or medications that lower blood sugar. Some seniors experience digestive issues with brown rice or other whole grain varieties because of the higher fiber content. If this happens to you, introduce these foods gradually to give your digestive system time to adjust. Start with small amounts mixed with white rice and slowly increase the proportion over several weeks. Chewing your food thoroughly also helps with digestion and blood sugar control. Eating slowly and chewing each bite well allows your body to register fullness signals before you overeat. It takes about 20 minutes for your brain to receive the message that you are satisfied, so rushing through meals often leads to consuming more than you need. Traditional cooking methods that involve soaking and fermenting rice may also provide benefits for blood sugar control. In some cultures, rice is soaked overnight or even fermented slightly before cooking. These practices may reduce the glycemic impact, though more research is needed to fully understand their effects. The quality of rice you purchase matters as well. Older rice that has been stored for longer periods may have a slightly lower glycemic index compared to freshly harvested rice. The aging process changes the starch structure in ways that can slow digestion. However, this should not be your primary strategy, as the difference is relatively small. Organic rice may contain fewer pesticides and chemicals, but from a blood sugar perspective, it does not have significant advantages over conventionally grown rice of the same variety. The type and preparation of rice matter much more than whether it is organic when it comes to diabetes management. Pre-packaged flavored rice mixes should generally be avoided, as they often contain added salt, sugar, and preservatives that can negatively impact your health. Plain rice that you season yourself with herbs and spices is always the better choice. This gives you complete control over what goes into your food. Reading nutrition labels when you buy packaged rice products is essential. Look for the total carbohydrate content per serving and check the fiber content. Higher fiber varieties will list at least 2 grams of fiber per serving. Be aware that serving sizes on packages may differ from the portions appropriate for diabetes management. Some seniors benefit from working with a registered dietitian who specializes in diabetes to create a personalized meal plan. A dietitian can help you calculate exactly how much rice fits into your daily carbohydrate budget, based on your medications, activity level, and blood sugar goals. This professional guidance can be especially helpful if you are struggling to achieve good blood sugar control. Understanding that managing diabetes is a marathon, not a sprint, helps maintain perspective. You will not see dramatic improvements overnight, but consistent small changes accumulate into significant health benefits over months and years. Each healthy choice you make contributes to better blood sugar control and reduced risk of complications. Stress management is another factor that affects blood sugar levels. When you feel stressed, your body releases hormones that raise blood sugar, making it harder to maintain control even when you eat correctly. Finding healthy ways to manage stress, such as deep breathing, meditation, or engaging in hobbies you enjoy, supports your overall diabetes management efforts. Sleep quality also affects blood sugar regulation. Poor sleep or too little sleep can make your body more resistant to insulin, meaning you need more insulin to process the same amount of carbohydrates. Aim for 7 to 8 hours of quality sleep each night and keep a consistent sleep schedule even on weekends. Regular medical checkups are crucial for seniors with diabetes. Your doctor should monitor your hemoglobin A1C levels, which show your average blood sugar control over the past 3 months. This test provides a bigger picture of how well your diabetes management strategies, including your rice consumption patterns, are working. Kidney function tests are also important because diabetes can affect kidney health over time. Your kidneys play a role in filtering excess glucose from your blood, and monitoring their function helps catch any problems early. Eating rice in appropriate portions as part of a balanced diet supports overall kidney health. Eye examinations should be done regularly as well, since diabetes can lead to vision problems if blood sugar remains poorly controlled for extended periods. While rice consumption alone does not directly cause eye complications, consistently high blood sugar from eating too much rice or other carbohydrates contributes to the risk. Foot care is another important aspect of diabetes management that connects to your overall nutrition. Good blood sugar control, including making smart choices about rice consumption, helps maintain healthy circulation and nerve function in your feet. This reduces the risk of serious complications that can arise from poor diabetes management. Some seniors find that their taste preferences change as they adjust to eating different types of rice. Brown rice that seemed bland or chewy at first may become more enjoyable as your taste buds adapt. Give yourself time to adjust rather than immediately dismissing healthier options. Cooking methods that enhance flavor without adding sugar can make healthier rice more appealing. Using herbs like cilantro, parsley, or mint, and spices such as cumin, turmeric, or cardamom can transform plain rice into a delicious dish. Cooking rice in vegetable broth instead of water adds flavor without significantly impacting blood sugar. Leftover rice can be transformed into healthier fried rice by using plenty of vegetables, a small amount of healthy oil, and protein sources like eggs or chicken. Making fried rice at home allows you to control the ingredients and avoid the excessive oil and sodium found in restaurant versions. Just remember to keep your rice portion modest, even when it is prepared in a tasty way. Soup is another way to incorporate small amounts of rice into your diet. Adding a few tablespoons of cooked rice to vegetable and protein-rich soups provides texture and satisfaction without overwhelming your meal with carbohydrates. The liquid in soup also helps you feel full, making it easier to be content with less rice. Stuffed vegetables are a traditional preparation in many cultures that allows you to use rice as a flavoring rather than the main component. Stuffing bell peppers, tomatoes, or cabbage leaves with a mixture that is mostly vegetables and protein with just a small amount of rice gives you the taste you enjoy while keeping carbohydrate intake reasonable. Rice pudding and other rice-based desserts should be considered occasional treats rather than regular parts of your diet. If you do choose to have these, make them at home, where you can control the sugar content. Use healthier milk alternatives, and include ingredients like nuts or seeds that provide protein and healthy fats. The emotional and psychological aspects of changing how you eat rice should not be underestimated. Food is deeply connected to comfort, memories, and identity for many people. It is normal to feel some sadness or resistance about changing eating habits that have been part of your life for decades. Acknowledging these feelings, rather than ignoring them, can help you work through them more effectively. You might need to grieve the loss of eating rice freely without restrictions. This is a legitimate emotional process, and being patient with yourself during this adjustment period is important for long-term success. Finding new foods and meals that bring you joy can help fill the space left by reducing rice consumption. Experimenting with different cuisines, trying new vegetables, or learning new cooking techniques can make healthy eating feel like an adventure rather than a deprivation. Many seniors discover foods they love that they never would have tried if they had not needed to adjust their diet. Building a support system of family, friends, or fellow seniors managing diabetes can provide encouragement and practical tips. Sharing experiences, recipes, and challenges with others who understand what you are going through makes the journey less isolating. Many communities offer diabetes support groups where you can connect with others facing similar situations. Technology can also support your efforts to manage blood sugar through better rice consumption habits. Smartphone apps can help you track your meals, log blood sugar readings, and identify patterns. Some apps even allow you to photograph your meals and provide carbohydrate estimates, though these should be used as guides rather than precise measurements. Continuous glucose monitors are devices that some seniors use to track blood sugar levels throughout the day without finger pricks. These devices can show you in real time how different rice preparations and portions affect your blood sugar, providing immediate feedback that helps you make better choices. However, not everyone needs high-tech solutions to manage diabetes successfully. Simple methods like keeping a paper diary, using measuring cups, and following a consistent routine work very well for many seniors. The best approach is the one you will actually use consistently over time. Setting realistic goals is important for maintaining motivation. Instead of trying to overhaul your entire diet overnight, set small, achievable targets, like switching to brown rice twice a week, or reducing your rice portion by 1/4. When you meet these smaller goals, acknowledge your success before moving on to the next challenge. Celebrating non-scale victories is also important. Notice when you have more energy, sleep better, or feel less sluggish after meals. These improvements in how you feel day to day are just as important as blood sugar numbers and weight changes. They remind you why making these changes matters for your quality of life. Understanding that setbacks are normal and expected helps you maintain perspective. You will have days when you eat more rice than planned, or make choices that do not support your health goals. What matters is not perfection, but getting back on track with your next meal, rather than letting one slip turn into days or weeks of unhealthy eating. Self-compassion during this process makes a significant difference in long-term success. Beating yourself up over mistakes increases stress, which ironically makes blood sugar control harder. Treating yourself with the same kindness you would show a friend going through a similar challenge creates a much healthier mindset for sustainable change. As you age, your nutritional needs may change, and what worked for managing blood sugar in your 60s might need adjustment in your 70s or 80s. Staying connected with your healthcare team and being open to modifying your approach ensures that your diabetes management evolves with your changing body. Some seniors find that their appetite decreases with age, making it easier to naturally eat smaller portions of rice. Others experience increased carbohydrate cravings due to medication side effects or other health conditions. Being aware of these changes and discussing them with your doctor helps you adapt your strategies accordingly. The relationship between rice consumption and diabetes management is complex but manageable with the right knowledge and approach. You have the power to make choices that support your health while still enjoying this important food. Every meal is an opportunity to practice these healthier habits and move toward better blood sugar control. Remember that managing diabetes through diet is not about achieving perfection. It is about making more good choices than poor ones, learning from your experiences, and gradually building habits that protect your health. The cumulative effect of these daily decisions determines your long-term outcomes far more than any single meal. Your commitment to learning how to eat rice in a diabetes-friendly way shows that you are taking your health seriously. This investment in understanding and applying these principles will pay dividends in the form of better blood sugar control, more stable energy levels, and reduced risk of diabetes complications as you age. The strategies I have shared today are based on scientific evidence and clinical experience with thousands of patients managing diabetes. They are practical, achievable, and designed specifically for seniors who want to continue enjoying rice as part of a healthy diet while keeping their blood sugar under control. So if you like this video, please like and subscribe for more videos like this.